Hi, I'm Kaylee Rosengren.
And I'm Tyson Rosengren.
We're Harper's parents. Harper was born with cleft palate, which was repaired before she was 9 months old. Early on, she was also diagnosed with torticollis.
Harper had a pretty tough first year, so she's a little bit behind. At the CGH Peds Rehab Center, we see a physical therapist, occupational therapist, and speech therapist.
Harper has been going to speech therapy since she was 3 months old. At speech, the therapist is working on increasing the amount of sounds Harper uses and encouraging her to use her voice instead of sign language to get what she wants and needs.
To increase her airflow and the loudness of her voice, they've taped her abs, which has really helped. They always want her to be having fun and always play bass, and they do a great job of letting us know what we need to do here at home to help our Harper. Harper really has come a long way since starting speech. They taught her 20-some signs so she could communicate with us what she needed before she could say the words. They worked on all of her vowels that she can say, and now we're starting to add consonants. She says M and B, and she's starting to do P. We're working on D. They also work on increasing her airflow so she can say the sounds louder, which she's getting really good at, and she's really starting to find her own voice.
Like speech, Harper has been coming to PT since she was 3 months old. They've helped Harper through every milestone that she needed to reach, from rolling over to sitting up on her own, crawling, and now most recently at the beginning of August, she's walking. She walks in acting like she owns the place and knows exactly where her favorite toys are and her favorite things to do. One thing Harper loves to do is climb on the jungle gym or walk up and down the stairs.
Another thing Harper loves to do is go into the sensory room. She loves playing with the bubbles, turning them on and off and changing all the colors. She also loves looking in the mirror at herself as she practices her squats and jumping in the air.
All of the therapists make sure that Tyson and I know what we need to do at home to ensure that Harper is reaching all of her therapy goals. The top priority of the therapist, whether it's speech, physical, or occupational, is making sure that Harper works hard but has fun doing it.
Tell me a little bit about Johnny and therapy.
Okay, so Johnny with therapy, as you remember, our biggest thing with him was trust from the very beginning. Coming from an orphanage setting, that was huge for him. He had to gain all of our trust, and so we started that with play therapy, which with you and Lindsay, basically, from what I remember, just playing, and which I thought was so cool. He just loved to come every Tuesday, Thursday. He loved to come to therapy. He loved to play. I mean, it was never, even though he worked so hard, it never felt like, I never felt like as his mom that it was a stress situation for him. It was just always full of fun and play.
What I would say with Leo is he's independent, right?
Yeah.
Leo is very independent in his, just in general, right? He is older child, so his therapy is more independent.
Right.
So you had to rely on him to come home and tell you a little bit more, like he had some self-reliance, and we kept you posted about what was going on, but he was really the one driving that bus more than you.
One of the things too, I remember that was, I felt like super significant was after his untethering surgery, then how that process went with the therapy, with the strengthening of his legs and how much that changed. The stretching, when Lindsay would tape him up, and how that would make such a huge difference in terms of his mobility and the way that he walked and turning. I remember when we were looking at his file when we were in the process of adopting him, and having other doctors look at him, and I remember that turned in foot, and then how you just see that the progression of it turning out, and all of the different things, all of the different things that the therapy, day in and day out, week after week, month after month, how that played into just helping him, to foster such a different ability to walk.
And Emmy's been even different more, right?
Yeah,
like
right,
Emmy's
right.
been entirely different too.
Right, so
And
Emmy just has so many sensory issues, which is so interesting to me, and I've never really known that much about that. She's just like a little noodle sometimes. It's a completely different ballgame with her. She really doesn't seem to have the fear factor as much as she's just like into everything and seeking, you know, lots of different sensory. I mean, I don't know what that would be.
Yeah, you're exactly right.
Yeah,
sensory seeking.
sensory seeking. I mean, I just feel like people need to know that it's like therapy through play. You know what I mean? It's not, it never feels like it's scheduled, or, I mean, it's very, you know, it's very centered, child-centered, and I feel like it goes from, you know, we kind of work, I mean, when they were all done, you know, we went on to the next thing. If that was, one thing wasn't working, we would go on to something else. And I learned so much. There's so many things that sitting in on the therapy process helped me at home to, you know, kind of reinstate those things as well. So I can remember coming, you know, for me too, it was definitely like a safe haven. I brought lots of questions, obviously, but also sometimes tears too, and you guys would address that and help me through that. And so that's what I've loved about it too. It's just became part of our family, especially those first couple years. I look forward to it as much as the kids did, because it was an outlet for me to kind of just let somebody else help them. You know, you want to help them in any way you can as parents, and so that was just really beneficial for me, and I look forward to it every week. And I can remember you saying, you know, at some point in time you'll get tired of us and it'll be time for you to move on, and I was always like, no, I never wanted that to happen, but I can see it now. I can see how it's progressed. We've seen Johnny come full circle.
Yes.
Went from going to no prosthetic and not having any ability to manipulate anything like that, from going to a walking leg to a running blade, which is what he prefers most times now. So it's amazing. Yeah, so go fast.
Yeah, go fast.
Hello, I'm Leanne Horton, and I'm from Milledgeville, Illinois, and I work at Northern Illinois Home Medical Supply, and have worked there for about 15 years. I was diagnosed with stage 2 ductal carcinoma in March of 2017. During my journey, I was blessed beyond measure. My family truly loves and supports me, and they were there with me every step of the way. I could have never gone through this without them. My friends and coworkers let me know by their compassion, graciousness, and reassuring smiles they were always there and thinking of me. I feel I am stronger and a more confident person who cherishes even the small day-to-day moments that I may have taken for granted prior to this journey. I'm truly blessed. My advice to other women is to take it day by day and lean on your family and friends for strength, as they are there for you and are more than willing to help you through this journey. And it meant a lot to me that I had such wonderful family and friends, and I think that's really important in life, is their care and their concern for you. The team at CGH was absolutely outstanding. I would recommend Mia, Dr. Ali Khan, all of the staff at CGH to help you get through your journey. They're very caring, understanding, compassionate. The nurses who do your chemo, you couldn't ask for somebody better to be sitting by your side helping you with your needs. The volunteers, I can't say enough about the volunteers. I'm doing really good today. I will be 2 years cancer-free in December. At least that's when I was done with my radiation, so that's kind of when I consider it my, party time is December. So in December, it'll be 2 years for me.
I'm Paulette Selmy, and I'm originally from Rock Falls, Illinois. And I left the local area for more than 35 years. I lived in Phoenix, Arizona, where I practiced there, but I knew I wanted to come home. So I'm home, and as a part of coming back home, I wanted to establish my medical treatment here at CGH. I had never been concerned about cancer in the past. Any kind of cancer or breast cancer. Surgery was scheduled for July 5th, and they did a lumpectomy, and they took some of my lymph nodes. So that day, right after the surgery, McGlone told me what it was. It was invasive ductal carcinoma, stage 2B. Invasive meaning it invaded the wall of the milk duct. The 2B refers to the tumor being more than 2 centimeters, less than 3 centimeters, and B refers to it being lymph node involvement. Just a little bit about the chemotherapy. The first stage was grueling. The first course was just horrible for me. During the second course of the chemo, I started getting swelling in my left foot and my ankle. So again, oncology took a conservative approach, and they sent me for an ultrasound to rule out any blood clots in my leg, and they also sent me to see the cardiologist, and so he could take a look at was there anything messing up there. Everything was negative, so we again proceeded. I was receiving the proper treatment protocol according to the research done by national studies, and I did my own research. During the whole process, I really never doubted I was in good hands. Never. They all listened to me, they had respect for me, and they answered all the questions that I had from start to finish. I also found the entire staff at CGH clinics, hospitals, including all support staff, receptionists, lab, x-ray, everybody I encountered here was compassionate and caring. So I just couldn't have been happier. And I just had absolutely no complaints about CGH. And this hospital and clinics definitely lives up to its mission, which is to deliver exceptional patient care by combining skill with heartfelt compassion. My most recent mammogram was in June of 19, and it was negative for anything that was suspicious. Yes. Going through something like this, or cancer, which could be potentially life-threatening, it teaches, or taught me about the fragility of life and the preciousness of life.
You're stage 4, no cure. I'm not invincible. I'm not superhuman. I can still be a superhero. My name is Star Coleman, and I was diagnosed with metastatic breast cancer at the age of 27. I am from Sterling, Illinois, and I work at Halo Branded Solutions. That day, it still feels like a giant blur to me of all kinds of information that I never thought that I would have to know or learn how to process. I had a great team at CGH that was there with me from the beginning. Erica Adams was my nurse navigator. She helped me to learn everything I needed to know about what was going to happen with my next steps, with my chemotherapy, potential surgeries, radiation. It was all gone through with me from the beginning to make me feel comfortable. I went to a conference in April. It's an AYA conference for just any type of cancer. So there's just a bunch of people there, and talking to people, like they go to these huge hospitals, university hospitals that have fantastic doctors, but they don't have any like one-on-one care. So like their team changes every week. They don't have a nurse navigator, and there's so many things I was like, what? Like, what do you mean you don't have a nurse navigator? Somebody asked me like, what do you do when you have a question? And I was like, I call, I ask my question, and they're like, no, we can't do that because there's nobody there. And I was like, that's insane. In this world today, I feel like as humans, we tend to think that we are invincible and we cannot be harmed or touched in any way. But that day I kind of learned that although I am not invincible, I'm not superhuman, I can still be a superhero. This journey has kind of given me an enlightened way of thinking. I have now learned, that I do have a voice. I can speak about different things. I can be an advocate. I can speak for myself. I can speak for other people. Being at CGH was great because I was home. I could go to my treatments at home. I could be close to my family. I didn't have to travel. I could work through my treatments. I could still do things that a normal person without breast cancer could do because I didn't have to go anywhere to get my treatment. I could go right down the road to CGH. Chemotherapy was actually my original plan, but because I had metastasis to my liver, it kind of derailed everything and took took surgery off the table, which it scared me in the beginning. But as I kept going through my journey and I kept going through the chemotherapy, everything started shrinking, and my liver tumors actually shrank, and they shrank enough to where we could no longer see them. So surgery got put back on the table, which was great because that was one thing that I really wanted to be able to get that done to kind of make sure that it was all gone and give me that peace of mind. So again, I got to work with CGH to help me find my surgeon in Peoria, to navigate me, to provide her the information that she needs to actually make sure that I had a great surgery, which I did. And I get to continue coming to CGH for my maintenance therapy that I will continue for the rest of my life. But even knowing that I have to keep going on this journey, I still feel comfortable because I know that I have a team of doctors and nurses and surgeons that are going to be with me the entire way. And right now, I know that the journey will not end, but I do know that I can get through it because I have superheroes surrounding me. I have superheroes within my community. I have superheroes within my medical team. I have superheroes in my family. So I know that I will get through this journey and I will continue coming through as a fighter. I will continue my radiation therapy that I'm doing now, and which is almost done. And I will get through that, and then I'll continue my life, and I will be able to make a difference in the world because of what I have gone through.